I'm Valerie Fadok. I'm a veterinary dermatologist from the United States, and I've been one dermatologist for over 40 years. I became a dermatologist for a number of reasons. First, I had a couple of professors in veterinary school that were very excited about skin diseases, and they stimulated my interest. But my interest really peaked when I graduated and went into my internship. The skin is an organ that is accessible to us. So I like the fact that I can see things. I don't necessarily have to do a blood test or, an ultrasound or a radiograph. So I can see the process. I love inflammation. It's a fascinating process, and I like to manage chronic disease. It's problem solving. So it appeals to the analytical part of my brain to problem solve. But the best part is seeing dogs feel better and seeing their owners be happy with them again. We know that pets are very important for the human-animal bond, and when dogs have skin disease, that bond gets broken. So being able to fix the skin and have the time to do it is magical, to keep these dogs in their home. I love it. Thank you. I think discovering that IL-31 is a major cause of itch in dogs is game-changing for us when we're treating allergic disease. And I think it's important that everyone know that Zoetis invested 10 years in research before they ever brought either Apoquel or Cytopoint to our patients. And because of that research, we have products that are incredibly safe. So I was able to use first Apoquel and then Cytopoint in my canine atopic patients, and the difference in their quality of life is amazing. I love the science, and I knew these products would work, but what I was not prepared for was how happy the clients were. They would be coming in and giving us hugs and smiling and saying, I have my dog back and my dog's like a puppy again. And so very valuable additions to our repertoires. I think knowing that a monoclonal antibody can stop itch and allergic disease is incredible. And the thing that makes me really excited about it is we got there before human medicine did. So they are learning from us. Monoclonal antibodies are an amazing revolution in the treatment of disease. They have transformed the treatment of a lot of human disease. And so to have the opportunity to use these fabulous monoclonal antibodies in the veterinary profession is critical. The value of a monoclonal antibody is it increases efficacy and safety. Because unlike a drug, antibodies are always very specific. And so having the opportunity to utilize a monoclonal for itch or in future for pain or kidney disease, the sky's the limit. And so finally our profession will have the benefits of these incredible therapies. And so what I learned, though, when I used this antibody in dogs is that the vast majority of my atopic dogs had a very good to excellent response within 1 day. Some dogs may take a little longer. It may take, up to 3 days. But most of my patients did very well. In fact, I used Cytopoint in my own dog, and it's transformative for him. He gets an injection, he stops itching, I can travel, and he stays very comfortable for 8 to 10 weeks. The average response is somewhere between 4 and 8 weeks. Some dogs will go longer, some shorter. But I think what veterinarians can expect is that they will get a good response in 90% of their patients.
Wow.
It's really incredible. To all my friends and colleagues in Colombia, you will be so excited to have this antibody in your toolbox for your allergic dogs.